This was the first placement that that's happened on, and that was probably the most challenging thing that I've experienced so far. 6 or 8 infusions running, and you've got all of them like stacked on top of each other with different IV infusion pumps and syringe drivers. Hey everyone, my name is Rowana. I am a nursing student from Sydney, Australia. Today I wanted to do a video just sharing with you my experience from my recent nursing ICU clinical placement. If you are new here, then welcome. I make nursing videos and I'm currently studying a Master of Nursing from the University of Sydney. And as part of my degree, I do have to do clinical placements, and also I do have to do a set number of hours in a high acuity setting. I was lucky enough to be able to go to a ICU. I've been very lucky to be able to actually get this opportunity in the first place. Also with COVID-19, it was a little bit more difficult with the circumstances around the placement in general. And I do have a vlog about that where I do go into a little bit more in depth about it as well. So I will link it down below and put a little thing in the corner here as well, so you can go and watch that if you want to. I wanted to make this video just to kind of share my experience from placement, maybe look at some of the different types of equipment that I saw on placement as well, maybe also look at some of the typical cases that we were seeing, and maybe go through a bit of a overview of what a typical nurse shift would look like for the ICU as far as I saw whilst I was on placement. Please keep in mind that this is just my personal experience from just 2 weeks in an ICU, and it's only one type of ICU as well. It can vary across different health settings. Any of the information that I put forward in this video is basically just my own personal opinion and my own personal view, and none of this should be taken as medical advice or health advice or anything like that. Just to kind of put a little disclaimer on this video as well. But now, with that being said, let's get straight into the video. Overall, I would say that this placement has actually been one of the best nursing clinical experiences that I've had throughout my whole degree. I've realized that I really love high acuity. I love being able to think critically about situations. I mean, you should be thinking critically about all situations, but there's like a different level in the ICU and in high acuity that I love. Something else that I really liked about this particular placement, you may already know, I have an undergraduate degree in psychology, and then I majored in neuroscience in that degree as well. So having that neuroscience background was kind of slightly beneficial to being on a neuro ICU. Yeah, it made me feel a little bit more excited about going on that particular placement. Can you just relax? What are you doing? That's my dog. Perfect timing, Sabi. So one of the most challenging things that I experienced on this placement was this was actually the first time that I've had one of my patients pass away. And I have friends that have experienced this already in past clinical placements. Even on their first placement that they were on, this has kind of happened. But for me, it didn't happen straight away. So this was the first placement that that's happened on. What I found quite difficult about this particular situation was that the patient we were looking after ended up being pronounced brain dead. And the whole process of the test for brain death is confronting in itself. What the doctors do is basically testing the neurological responses to stimuli, and that's including painful stimuli. It was quite hard watching that test to be done. Something else that I also found hard about it was that the patient's kind of there, they're connected to monitors and everything's saying that all the vital signs are normal, they've got a ventilator, their chest is moving because of the ventilator, but in all intents and purposes, that person has died. So seeing them kind of look quite normal and just kind of like they're sleeping, but knowing that that's happened was also quite confronting for me. And so I just wanted to address it here because that was part of the placement and that was part of my experience. And that was probably the most challenging thing that I've experienced so far. Something a little bit more positive about this experience was that this person ended up being an organ donor. So knowing that potentially 1 to a few people will then have someone's organs and are able to have the potential for a better quality of life, that in itself made the whole situation a little bit more special and beautiful for the family and for everyone that was involved. So it made the experience a little bit better in my opinion anyway. Something I do want to mention that on this placement, all of the nursing staff were absolutely incredible. I had heaps of the nurses just so willing and so excited to have students there that they could teach. I have no idea why. I mean, most of us are pretty helpful, I think. But yeah, it was just so nice having someone like excited to have someone there just to like teach them. It was very nice. But I remember like I had one nurse there who pretty much went through for a full hour and a half, went through a full head to toe assessment with me, let me do everything, gave me some advice, critical analysis, and giving me some insight as to how to do certain assessments and things like that. And that was very helpful and an incredible opportunity as a nursing student to have that level of education. It was great. I think ultimately this placement has kind of cemented the idea of going into a high acuity nursing clinical environment when I finished my nursing school. It was such an incredible experience and by far the best placement that I've had. It's made me realize that I really enjoy high acuity nursing, and I think it couldn't have come at a better time because we're currently about to start applying for our new grad positions, and I might start looking at options for new grad where there are options for high acuity nursing streams. So yeah. It was very cool. All right, some of the machines and equipment. So patients in the ICU are a lot more critical and have a lot more complex conditions going on compared to the stuff that you would see in a typical ward setting. And in that sense, you would hopefully see a lot more complex technologies, medical equipment and monitoring devices, things like that, because they do need more complex care. Devices and things that you would see, continuous monitoring, cardiac monitoring, essentially seeing their vital signs displayed, continuously updated, constantly monitoring, which is fantastic. You've also got things like different types of ventilators, and as you can imagine, they're very complex, and at my level, I don't actually have to understand everything about the ventilators, but it was very cool seeing how the nurses were looking after patients that were ventilated. There's a lot of considerations that you have to think about. So yeah, ventilators. Other things like having like the IV pole next to a patient that's got like anywhere from like a couple of different infusions running to like 6 or 8 infusions running, and you've got all of them like stacked on top of each other with different IV infusion pumps and syringe drivers. Yeah, that in itself is just an art form. It's insane how complex it can be. And then things like central lines, arterial lines, peripheral IV cannulas, indwelling catheters, that's like the thing that goes up into your bladder so that you can just pee straight into a bag. Lines everywhere on a patient, just very complex. But I think those sorts of technologies, for me, they were extremely confusing. It was amazing to see how well the nurses kind of dealt with everything, and that's part of their daily assessments, like going through making sure that everything is correct, all the medications are correct, the monitoring equipment is correct, all the parameters are set correctly so that it'll alarm at the right parameters, all that kind of stuff. It was pretty cool to see. Something else that I wanted to mention that's kind of more particular for a neuro ICU situation is an EVD, and that stands for an external ventricular drain. I'll try and put a picture up on the screen, but an external ventricular drain, or an EVD, is basically a tube that goes into your skull and into the center of your brain into one of the ventricles. So if you can imagine your brain, you've actually got these holes in the middle that have cerebrospinal fluid that's filling those ventricles and surrounding the brain and your spinal cord and that kind of stuff. And the drain goes in there, and its purpose, really, as far as my understanding goes, is that it's measuring your intracranial pressure and potentially draining some of that fluid as well. So that is something that I did see on quite a few different neuro ICU patients, depending on the situation that they were in for. And I don't think you would be seeing it in many other places either. Interesting. So yeah, that's just some of the technology and medical equipment that I got to see on my neuro ICU placement. Types of cases. So I was on placement at a time when the Australian government were kind of ceasing any non-emergency or elective surgeries. And I don't know if that actually had any effect on the types of cases that we were seeing in the ICU at the time, but I did notice that pretty much all of the cases that I was involved in were from some sort of emergency situation that had occurred. So whether that's like a neurological trauma, so like maybe someone's hit their head from a fall or like a car crash or something like that, that potentially could be a situation where they might need surgery on their brain and then have to go to the ICU after that. that. Other cases, potentially a stroke. We did have someone come in who had a stroke and had thrombolysis treatment, but then ended up being allergic to the treatment and then had to be monitored and managed for that. So they ended up coming into the Neuro ICU so that they could be cared for properly when it comes to the neurological side of things. Potentially wasn't strictly a neuro case, so things like that could occur as well. Also had quite a few people that had come in with aneurysms, whether they had burst, so like a hemorrhagic stroke, or had just had an aneurysm that needed to have coiling treatment or something like that done. There were quite a few people that had come in with that kind of situation as well. That being said, there was some occasional cases that weren't strictly neurological, and I think the reason that they were in this particular unit was just because it was a bit of an overflow from some of the other ICUs that were a little bit more inundated with some other cases that were going on, and they just needed an extra bed, so had come into the Neuro ICU that I was sitting in, working in, doing placement in. Yeah. So yeah, not everything was strictly neuro, but majority of stuff was. Pretty much all except like one or two. Yeah. Okay, and finally, I just wanted to go through like a typical shift for a nurse, what kind of stuff they would do, what they would do first, what kind of things they would see on a shift, how long the shift is, what I got to see while I was doing the shifts there. So that kind of stuff. The first thing that happens, you get into the unit, you put your bag away, and you pretty much do handover straight away. The difference that I saw in the ICU compared to like a ward setting from the placements that I have been on is in the ward, you usually do a handover for the whole unit, and everyone that's oncoming for that shift would get a handover of everyone in the ward. But on the ICU, your handover is just the patient that you're kind of assigned to look after for that shift. And that could be maybe one patient, maybe two patients, depending on how severe the cases are or what level of care they would require. Kind of anything from like 1 to 2 patient load. And that's just like what I saw on this particular unit. That could be different somewhere else. So please don't just take it at face value, but that's just something I saw. Next thing after handover, you would do all of your equipment checks. And so that's checking all of the monitoring equipment, the ventilator, making sure all the settings are correct, checking all of the lines, making sure they're all connected correctly. Also all of your emergency equipment, making sure that any of the bedside emergency equipment, so things like artificial airway devices in case there's like an extubation or if the patient's not intubated and they have some sort of collapse of their airway, you've got all of that stuff there. All that kind of stuff that you want to make sure that is all prepared just in case there is an emergency situation so that you have everything ready just in case. At the same time, the nurses will then do like their full assessment of the patient for their shift, and that's doing everything like a head to toe assessment of their patient, checking like if they've got an ETT tube, like an endotracheal tube, making sure it's inserted at the correct level and it's measured with like in centimeters and it's marked on the tube and you can tell where it's sitting at the teeth. And then you've also got things like an NG tube, which is like a nasogastric tube, and you have to then check whether that's inserted correctly as well, and if it's still inserted at the correct centimeter mark as well. Other things like checking line insertions, making sure that the arterial line is still in and in place. Central line, if they've got a central line, making sure it's still patent, everything's still running correctly. If the patient's sedated, making sure that all of the medications are running as they should. And then checking things like doing a respiratory assessment, abdominal assessment, full integumentary assessment. So that's checking all of the skin, checking for any pressure injuries, any bruising or anything that might be suspicious of something that might be going on that you haven't picked up before. Neurovascular assessment, making sure that they're getting enough blood towards all of their extremities. So checking like their capillary refill, making sure it's less than 2 seconds. And then like their GCS. So that's like a neurological assessment. Are they conscious? Are they awake? Are they alert? Can they respond to your voice? Are they obeying commands? So you do all of those assessments at the start of the shift. And then something they were doing on this unit, which I'm not sure if this is the same for every unit in ICU, but it was for this one, they do hourly observations. And even though they've got continuous cardiac monitoring, they log it into their system on the hour, every hour. And that's kind of how it gets documented and recorded. Obviously, they're sitting there the whole time and they're making sure that the patient is still within those parameters. And if something does kind of jump out and isn't quite normal, they will kind of jump into action straight away. It's not like they're going away for an hour and coming back and then just checking on them once an hour. So a lot of the patients in ICU, they would get their observations documented, any fluid input and output, so like a very thorough fluid balance chart. Also potentially doing another neurological assessment every hour as well, depending on the severity of their neurological status. Other things that I saw were having to prepare patients for different procedures that they were ordered to go for each day, whether that's like going to surgery. I had a patient that went up to angiogram one day as well. Like, especially if the patient is intubated, there's a huge procedure that needs to happen if they are to be transported to a different part of the hospital. If they are on a ventilator, you need to make sure that you have a transportable ventilator. Continuous cardiac monitoring and all the monitoring systems have to be transportable as well. Any equipment, if there was a cardiac arrest, you have to be able to carry that with you. And if there's an accidental extubation, making sure you have all of the equipment for the doctor to be able to perform an intubation. If it was to occur, you can transport all of that equipment as well. Also things like an extra oxygen tank, just in case you get stuck in an elevator and you have to hook them up to another oxygen tank or something like that. Lots of things to consider, making sure that all of the medications that are being infused are coming with you and attached to a transportable pole on the bed or something like that. Yeah, lots of things to consider if they are going away for a different procedure outside of the unit. And then other things, just like caring for the family members at the bedside, calling, like if a family member calls up and the nurse has to talk to them about the condition of their loved one, anything like dressing changes, taking the patient up to the ward once they've kind of graduated from ICU and are able to go to the ward if they're well enough. Also, when doctors do their rounding, the nurses will be able to give like a handover of what's been going on with the patient, and the doctors may ask questions as well, so they have to be there for that. Yeah, and in terms of shifts, like as a student, we were only doing an 8.5-hour shift, but the nurses on the unit would typically do 12 hours most days. And I think with the schedule, there would be a potential for a couple of 8-hour shifts every fortnight or so as well. So yeah. All right, that's kind of everything I wanted to cover in this video. I just wanted to share my experience of the ICU and the fact that I enjoyed it so much. Yes, there were a lot of things that I did find challenging. It was very complex and a lot to get your head around. And there was some very sad moments in the ICU as well. But apart from that, I loved the clinical experience, I loved the placement, and I would love to be able to work in high acuity at some point as well. If you have any questions for me about Neuro ICU or my clinical placements or my degree or anything, you're welcome to leave me a comment down below or send me a message on Instagram. I can leave that link down below as well. And if you like this video, please give it a thumbs up. And if you want to see more from me and my channel, please click the subscribe button down below. I will see you guys in my next video. Bye.